Starting with psychological disorders, defining and diagnosing. Possible models for defining is a mental disorder a violation of cultural standards? You're doing things that are just not normal. Homosexuality used to be considered not normal. Mental disorder is a maladaptive or harmful behavior. Man, you keep killing people. That's a problem. We're going to call it a mental disorder. Or is it just the fact that you're not happy? Is that a mental disorder? Is obesity a disorder? Of course, that'd be physical. But is discomfort always a mental disorder? It's interesting. Mental disorder is any behavior or emotional state that causes an individual great suffering or worry, is self-defeating or self-destructive, or is maladaptive and disrupts personal relationships or the larger community. When does an issue become a disorder? When it hurts your ability to have relationships, to have a job, and to be content. That's what I say. So sum it up with those three words. Relationships, job, and contentment. The DSM is like the Bible for psychologists who do therapy for insurance purposes and in order to sort of diagnose you and figure out what your problem is. They'll look into clinical syndromes. What is wrong with you? Is it depression, anxiety? And they might look a little further into Axis 2. Personality disorders. Are you bipolar? Are you borderline? Axis 3 is important because we need to know what else is wrong with you medically. Do you have a physical problem? Do you have dyslexia? Do you have hypothyroidism? So that you struggle with being overweight, and that affects other things, right? Psychosocial and environmental conditions. We want to know, do you have a support system? Do you have friends? Do you live in a safe area? Are you in school? Are you learning? And then finally, the Axis 5, the GAF, the Global Assessment of Functioning, allows for a universal sort of assessment of how you're doing on a scale from 0 to 100. Depressed individuals are likely to get a score of less than 60 or less than 50. And as they get better over time with therapy or with an antidepressant, that number is likely to improve. Concerns about the system, overdiagnosis, the power of diagnostic labels. These labels can follow you around forever. And confusion about serious mental disorders with normal problems. And one thing I've always just repeated to you guys is that we all have threads of disorders. We all can be a little narcissistic. We all can be moody. Doesn't mean we're bipolar. We all can be a little sad. Doesn't mean we're depressed. We all show aspects of disorders at different times in our lives. So, looking at projective tests, these are tests that psychologists may use to infer our motives, conflicts, and unconscious dynamics on the basis of how you, as the client, interpret ambiguous stimuli. Remember, Rorschach inkblot test, as we see here. How you might interpret that might tell me a lot about what's really going on in your head. Okay? Objective tests are more surveys. Standardized objective questionnaires requiring written responses. They typically include scales on which people are asked to rate themselves. Rate yourself on a scale from 1 to 10, 10 being very intelligent, 1 being very not intelligent, unintelligent. Right? That could be an example. MMPI is the most commonly used inventory of personality. Anxiety disorders are interesting and very prominent. A lot of us have them. Anxiety and panic, fears and phobias, obsessions and compulsions. A lot of these things light up for you. Doesn't mean you have a disorder. Just means that you're a normal person who experiences anxiety sometimes panic. Some of you may have panic disorder. We all obsess and compulse sometimes, especially in our society that teaches us to obsess and compulse. watch another Netflix, watch pornography, obsessions, be focused on this celebrity forever, always. Our society tends to really, what's the word? Behaviorism? Let's say reinforcement, right? Operant conditioning. It reinforces our obsessions and our compulsions and makes them more likely to continue. So, anxiety and panic. We have the most common anxiety disorder, generalized anxiety disorder, a continuous state of anxiety in which we feel worry and dread in a lot of areas. Apprehension, difficulty concentrating, signs of motor tension. Panic disorder is sort of the other end of that spectrum where anxiety is not acting normally. Anxiety is overflowing, so to speak. An anxiety disorder in which a person experiences recurring panic attacks, feelings of impending doom or death, accompanied by physiological symptoms such as rapid breathing and dizziness. These are very uncomfortable. They last about 15 minutes. You will feel like you're dying. A lot of people end up in the ER because they think they're having a heart attack. You will feel scared to death during a panic disorder. But it will go away, can be helped with medicine, can be helped with therapy, and self-regulation. Calming yourself down can help. PTSD, anxiety disorder in which a person has experienced a traumatic or life-threatening event, and as a result of that event, gets sort of stuck in a loop of that fight or flight mode. Psychic numbing, reliving the trauma, increased physiological arousal. These people have a lot of trouble staying calm because they're always in that fight or flight mode. They often have a lot of difficulty sleeping, and they are very anxious. They often abuse substances to calm themselves. Fears and phobias. A phobia is an exaggerated, unrealistic fear of a specific situation, activity, or object. I emphasize that we all should be a little scared of snakes, but seeing a snake in a picture should not make you vomit or run away. That would be a phobia. That would be an exaggerated, unrealistic fear. That snake in the screen cannot hurt you guys and girls. Obsessions and compulsions may lead to obsessive compulsive disorder. It's a disorder, again, when it starts to impact negatively, severely negatively, your relationships again, jobs, and contentment, ability to sort of live a normal life, so pay your bills, to feel happy. An anxiety disorder in which a person feels trapped in repetitive, persistent thoughts. These are obsessions, and repetitive, ritualized behaviors. These are compulsions designed to reduce anxiety. We do them to reduce anxiety, but it's abnormal because most people don't have to do these obsessive things and compulsive things to get rid of the anxiety. Worrying about whether we lock the door 10 times, going back, checking the door, checking it once again, checking it 10 times, counting things. All these repetitious behaviors do reduce the anxiety of a person with OCD, but the rest of us get to lock the door once and move on our merry way. These people often have to leave for work 2 hours early so that they can go through this ritualized process. Now, is it affecting their job? Probably. Their relationships? Who wants to be with a person like this? You've got to be real patient. Your ability to be happy. That would make me very unhappy, having to go through that all the time, feeling that intense anxiety. And as I said to you guys, it's bad enough, right? When we have walked inside, have to walk back out to our car because we're not sure if we locked our car. We just don't feel right until we've just clicked it again. Mood disorders. Depression and bipolar are the two we're going to focus on, theories of depression. Major depression is a mood disorder involving disturbances in emotion, excessive sadness, behavior, loss of interest in usual activities. This is probably the most common thing. When you notice people aren't enjoying the things they normally enjoy, it's a good sign they have depression. Cognitions are filled with thoughts of hopelessness, dread, just thinking sad thoughts, and body function. They often have fatigue. They're tired all the time. They don't feel like eating ever. In fact, again, I have mentioned to you that depression, another word for that, or phrase, is anger turned inward. So a lot of times they don't feel they deserve to eat. They don't feel they deserve to get better. They feel they deserve to be sad the rest of their lives because they're worthless in their opinion. Symptoms of depression, I got to meet 5 of these symptoms within the past 2 weeks. I'll let you read those for yourself quickly. Mood, sleep disturbance is pretty common. Fatigue, feelings of worthlessness are very common. Recurrent thoughts of death are important to note because this is when suicide may be an issue to watch out for. So looking at gender and age and depression, women are twice as likely as men to be diagnosed with depression. Is this because women are more likely to go to a doctor and report their feelings and emotions? Is it because more men are historically male? After age 65, the rates of depression drop sharply in both sexes. Theories of depression. Biological says that our genetics and brain chemistry are what cause us to be depressed. Social explanations emphasize stressful circumstances in our lives. Well, I had a breakup. I had a divorce. A loved one died. Attachment explanations emphasize problems with close relationships, which would be very similar. Now, the thing to note here is that it's not one or the other. It can be all 3 of these playing a role in helping us understand why people get depressed. Cognitive explanations emphasize that people may have particular habits of thinking and ways of interpreting events. They can be negative people or positive people. Negative people are likely to see the glass half empty, right? And so overall we might have a vulnerability stress explanation, such as your genetics make you predisposed to depression, and when you get stressed, that leads to depression. It draws on all 4 explanations described. Bipolar is a mood disorder in which episodes of depression and mania, which is excessive euphoria, occur. So one, and then the other, and then back to the first. And these people are hard to predict. And they don't like it either. They have a lot of problems with it. And again, the mania is not happiness. It's excessive euphoria. A feeling that you're all powerful. A feeling that you can't get hurt. A feeling that I can sleep with anybody and everybody I want and I won't get a disease. So you can see how mania can be dangerous. Spending a lot of money and not realizing the possible consequences. Alright. Personality disorders. Problem personalities. We're going to focus on APD, antisocial personality disorder. A personality disorder is a rigid, maladapted pattern that causes personality distress or an inability to get along with others. A narcissist personality disorder is a disorder characterized by an exaggerated sense of self-importance and self-absorption. These people aren't just like childlike. They actually think they are the center of the universe. Again, we are all narcissistic to a great degree, especially in our teen years. But some people really have a problem with narcissism. And the paranoid personality disorder is a disorder characterized by habitually unreasonable and excessive suspicion